It used to be simple. Take an aspirin daily to protect your heart. However, three major clinical trials, ARRIVE, ASCEND, and Aspirin, didn't show a benefit for the use of aspirin for primary prevention of cardiovascular disease. Despite this, a recent survey representing about 150 million adults annually showed that in 2021, nearly a third of adults over 60 years of age without cardiovascular disease were still using aspirin, with about 1 in 20 using it without any medical advice. So, who should take aspirin? Well, definitely take or continue it if you have a history of acute coronary syndrome, in other words, a heart attack, percutaneous coronary intervention, including balloon angioplasty and stent placement, coronary artery bypass grafting, or other forms of atherosclerotic cardiovascular disease, ASCVD, including stroke. Aspirin is still recommended for secondary prevention. For primary prevention, we would consider low-dose aspirin if you're between 40 and 70 years of age, deemed to be at higher risk of ASCVD, but not at increased risk of bleeding. Also, recent studies suggest that individuals with high coronary artery calcium score, based on a coronary calcium scan, might benefit from aspirin. Who should not take aspirin? Well, daily aspirin is not recommended for people with no history of heart disease, deemed to be at low risk, or those with a high risk of bleeding, for example, from gastric ulcers. Long story short is that it's complex and there's a lot of nuance here, so talk to your doctor or preferably a cardiologist if you have a heart history to see if a daily aspirin is right for you.